Hello, everyone. We have a lot of new folks joining, so we'll give just a few more minutes as people come in, and then we can get started. Thank you for being here. Okay, I'll give just one more minute or two. Seems like we might have slowed down on people joining. Oh, spoke too soon. Thank you for being here, everyone. Welcome in, everyone. Happy Thursday. Happy April. The last time we were convened was February, so it's great to be here with you all again. Okay, I'm going to start sharing my screen. And we can get started. And as people trickle in, we'll welcome them in. So come on in, everybody. Thank you for being here. Anne is traveling across Nevada this week as part of the Nevada Rural Health Transformation Tour. So right now she's actually driving into Ely this evening and might not be able to join us for this meeting. She might try to hop in at the very end, but unfortunately she won't be here for most of it, but she is sending us her support from the road. So welcome everybody. This is our Children's Behavioral Health Transformation Working Group meeting. So thank you for being here. Here's our agenda for today. I want to note just a small change from what's posted online. We're going to be receiving a demo of the Children's Behavioral Health Data Dashboard before our discussion for the evening. So we'll be ending our meeting with the discussion. So we'll go through our new working group members and a little bit of what's happened since February. We have an update on our screening tools. We'll go over a recent event that we had with our independent reviewer site visit that happened last week. We'll talk about our data dashboard, and then we have a discussion topic for everybody that we're curious on your thoughts. And then we'll wrap up and reconvene again back in June. So starting with roll call, we have a lot of new members who we are excited to meet. So from February until now, we had asked everybody to submit a new application for the working group. We opened up the working group for new members to join, and we had a ton of really awesome applications. So thank you to everybody who applied to be a representative in the working group. We had folks from across Nevada who are currently involved in children's behavioral health every day apply, and we picked some really awesome folks to join us as new members and have a lot of our members who have been working with us for the past little over a year now want to join and continue working with us. So thank you so much to everybody. Unfortunately, We weren't able to accept everybody into the group, so if you applied and you were not accepted this year, please stay engaged. We would really love for you to continue joining these calls, and we still welcome your feedback during public comment periods or on any public feedback opportunities. With that being said, I thought today would be an awesome opportunity to meet our new and existing working group members and to celebrate some of our wins in Nevada. Knowing that we sometimes only focus on what we are working to improve and we don't always celebrate the great work that we have already done, I sent out this question to our working group members ahead of this meeting so that everyone could prepare. And we would love to have our working group members come off mute and share something that you have seen or done in the state that you are proud of. And in alignment with Anne being absent from today, she does send her sincere gratitude to each of our working group members for your time and effort in this meeting, previous meetings, and for what you're committing to moving forward. And she is really looking forward to meeting you all virtually in our June working group meeting. So I know that this is a lot. We have expanded our working group, which is really exciting. I have 2 slides that have the names and orgs of our working group members, and I'd love to just go down this list. And anyone who is present, please come off mute if you feel like sharing your name, organization, and if you thought of something, please share something that you've seen or done in the state that you are proud of. And then if you are in the audience, and you still want to share in the celebration, please use the react functions in Teams, or I would also invite you to add something that you are proud of in the chat. So starting with our representatives, our first representative on our list is Matt, if you want to come off mute.
Hi, everybody. My name is Matthew Lehman. I'm a local ABA provider as well as a foster parent. One thing that I'm super happy of having done this past year, I'm going to cast a little bit in advance. It looks like I'll be able to finish finalizing adopting my foster teenager next month.
Wow, that's amazing. Congratulations. Thank you for being here. Okay, John. Okay, Heidi, are you here with us? That's all right. Azraela.
Hello, everyone. I'm Azraela Gravel. I am a part of the Medicaid Advisory Committee, and I'm a vice chair on the Beneficiary Advisory Council. I have a master's of public health and epidemiology. This year, I'm pretty proud of Lombardo's efforts to enforce the Nevada Safe Streets and Neighborhoods Act. It defined sexual assault and stalking and gave women more rights and those protections. And so I thought that was very awesome. Thank you for having me aboard and being a family representative.
Thank you for being here and thank you for sharing. Brenna.
Hello. Hello, everyone. I'm Brenna Hartner. I'm the team facilitator with Youth Move Nevada. And I'd say that I'm proud of how Youth Voice is being centered here in Nevada. I'm especially proud of the young people in Nevada who shared their lived experiences for the Care Coordination Summit last year, because they really just helped shape what care coordination will look like for youth in the state. So I'm really excited to be back as a youth representative. Thank you for having me.
Yay, thank you so much, Brenna. We're happy you're here. Annalicia. Luke, are you on right now? Brittany.
Hi, I'm Brittany Frew from New Frontier Behavioral Health Center in Fallon, Nevada. I think one thing that I'm super proud of that we've been able to accomplish this year is maintaining our social emotional program that we can provide for the schools and the after school programs within Churchill County at no cost to them. That's really been helpful to link that preventive to the treatment aspect.
Yeah, that's really awesome. Thank you for being here.
Yeah, absolutely.
Dave?
Thanks for having
Yeah.
Hey, Chris. Good afternoon, everyone. Dave Doyle with Eagle Quest. It's a pleasure to see everybody on this round of the working group. I'm actually proud of all of us. I'm proud that we are continuing to not, this last year we've broken the cycle of operating in silos and we're working together as partners. We continue to have open and transparent dialogue where we're responding to each other. And I think we all realize that the system is better when we're talking and working together. And it's definitely, we're gaining progress. And then something personally at Eagle Quest, I'm pretty excited. We've opened a couple QRTP-like programs. We're waiting for the Medicaid language to be finalized and approved, but the qualified residential treatment programs for commercially sexually exploited girls as well as at-risk teen boys to kind of help reduce congregate care in places like Child Haven. So we're glad to be part of this group. Thank you.
Awesome. Thank you so much for joining and for your kind words for all of us. I agree. I'm proud of us too. Anya?
Hi, my name is Anya Earl. I'm Executive Director at SAFI, a treatment foster care agency here in Las Vegas. I am so proud of all of the new therapeutic models that are being promoted here in Nevada. I'm excited for our state to get models like child-parent psychotherapy up and going and TBRI more generally across the state. So just really excited for all of that and the investment that appears to be happening around that.
Yeah, thank you so much, Anya. Laura?
Hi, everybody. I'm Laura Anderson at Sierra Sage Treatment Center, and our treatment is very individually focused. So I've gotten a couple of outreach from some former clients this past week, and every time we get them sharing something that they're proud of from having returned back to their community and back to their home, it reminds me of why we're all in this, doing this work to help folks heal and be able to go home and live the lives they deserve.
Yeah, absolutely. Thank you for sharing. Megan?
Hi, I'm Megan Freeman. I'm a licensed psychologist, and I oversee a team of staff who go into community-based locations like the Boys and Girls Clubs to provide services where families already are, so they feel more comfortable and have more access to care and better access to care. We are branching out to new partners, and I'm excited that this year we started working with charter schools, and we've been going into Nevada Rise Academy, and we've been able to connect some children there to care who were not able to otherwise access it, and that's exactly what we're here to do.
Yeah, awesome. Thank you so much for sharing. We're glad that you're here. And also, thank you for just following the order. We have more than one Megan in this group.
I figured I would
Glenda?
just roll with it.
Yeah, we appreciate that. Glenda, are you on? Okay, Natalie?
Hi, good evening. I'm Natalie Sanchez. I'm one of the owners of Health Psychology Associates and a marriage and family therapist. Over the past year, one of the things that as an agency we're really proud of is we continue to grow and we accept all Medicaid and accept all forms of insurance. And in addition to providing therapy, we also provide neuropsych assessments and early childhood assessments, and really feel passionate about trying to provide quality services for folks. So just always happy to be a part of this group and see everybody on here. So thank you.
Yay. Okay, thank you, Natalie. Griselda? Dr. Lloyd?
Hi. Oh, hi. Hi, I'm Griselda. I'm new to the group, so I'm very excited to be here. I am the owner of Core Mental Health Services, and one of the things that I am proud of is, as well as being in this group, is getting our contracts with juvenile justice and the mental health courts with Clark County in order to be able to help the children out there that need with parents with drug and alcohol, and just going from there and seeing how we can best fit the underserved population.
Yeah, that's awesome. Congratulations and welcome. Stephanie?
Hi there. Can you hear me okay?
Yep.
Okay, great. Sorry, I'm driving. Apologize. My name is Stephanie Brown. I'm the Director of Business Development for Renew Behavioral Healthcare Hospital. And the thing I'm most proud about is the fact that we saw a need in our community, in our emergency departments here locally and then in our surrounding counties for younger aged kids under the age of 12. So that was about a year and a half ago. So we have been accommodating those kiddos that need that crisis intervention and inpatient stay from 8 years old to 12. And that was supposed to be temporary, but we are actually going forward doing that indefinitely because we do have a need and see a need, and we don't really have any other inpatient psych help for these kids at that age. So that's what I am most proud of. Thank you for having me today.
Absolutely. Thank you for being here. That's really amazing. And thank you for seeing that need, filling that need. I think that's a goal that we all share here of what we're trying to do. And you have a really awesome example of that. And everyone has been sharing really cool things. So thank you. Megan Martinez.
Hi, I'm Megan Martinez. I'm new to this group. And I am the director at Carson Tahoe over inpatient and crisis behavioral health. And I'm super proud of my team this year because in November, we were actually able to open up a youth crisis and an inpatient youth unit, which is really, I think, a huge victory. And it was really, really needed. So I'm super grateful for that and really proud of my team.
Yeah, absolutely. Thank you so much for being here and welcome. And we have Steve. Steve, if you're able to come off mute.
I am so sorry about that. Can you hear me now?
Yeah, absolutely.
Okay, great. I can't believe I forgot that. But anyway, I was just saying, my name is Steve Shell. I've lived in Reno for 16 years now. I've designed and opened several treatment facilities around the state in Las Vegas and Reno. A couple of years ago, I founded the Behavioral Health Association of Nevada. And I think I'm really proud of the fact that we've really been gaining a lot of traction around the state over the last year. We are truly an all-inclusive group of providers and allies. We're not just exclusive to one discipline or another. We include everyone. We're not looking to replace or duplicate any of the other associations in the state, but we are hoping to become that collective voice. And we are very focused on some policy revisions that we want to push in the upcoming 2027 session, among other things. So very glad to be here and work with all of you. Thanks, Carissa.
Awesome. Thank you so much for being here, Steve, and welcome. Okay, now we're on our second list for our representatives. So we'll start with Lindsay. Okay, Jessica. Okay, I'm not seeing Jessica in our meeting, but she is our co-chair, so hopefully we'll be able to hear from her soon. Miambi? Shayla?
Hello, I'm Shayla Holmes. I am with Lyon County Human Services and proud of many things happening out here in Lyon County and across the state. But one thing is we just wrapped up our first full year of services with our youth crisis response. Been doing a lot of in-person response out here for Lyon County Youth, and that's really exciting for us out here to have that complete its first full year and continue forward.
Yeah, that is really exciting. Congratulations, and thank you for being here. Sherilyn?
Hi, Sherilyn Rohr-Wood. I am the Director of Behavioral Health Programs at Nevada Rural Hospital Partners, working with all 13 consortium of the 13 critical access hospitals. I think two things. One, I just participated in the first cohort of the CBI, which was phenomenal. And I think of the 6 groups that individually worked on projects or recommendations for the state. And there were multiple state leaders at the table while we were giving our presentations, and we really got some good feedback. And so we might see some Medicaid changes, potentially we could see some policy changes, but I think the recommendations that we gave to the state for our IDDD population were very thoughtful and very intentional, and really potentially could help cover some of those gaps and barriers that we struggle with when we're working with our youth out in especially the rural regions. So I think that was a big piece, and that was 9 months in the working. So proud of that. Also proud of the crisis de-escalation intervention training that I am creating for critical access hospital emergency departments when working with the IDDD population, whether adults or youth. And so excited about getting that training. It's a 45-hour training for our critical access hospitals out there. So thank you.
Wow, awesome. Thank you so much. We appreciate hearing about those updates. Dana?
Hey, my name is Dana Robinson. I'm a licensed clinical social worker with the University of Nevada's Positive Behavior Interventions TA Center. And I'm here representing like mental health in schools and what that looks like. I was born in Winnemucca and raised in Fallon, and so Nevada is dear to my heart. I'm sure I got healthcare in schools my whole childhood. And I've been really proud of Nevada's youth. It's been so cool to see mental health just become very normalized and part of like existing as a human and the flow of that. And so I think that comes from a lot of this work and kids just being cool and figuring stuff out. But there's definitely less stigma around receiving treatment for mental health care, and that feels really good.
Yeah, absolutely. Thank you for sharing that and welcome. We appreciate you being here. Dr. Lewis? Caitlin? Amy? Karen?
Good afternoon. Karen Tager, Executive Director of Nevada PEP. And I am very proud that Nevada PEP has been serving families across the state for 30 years. And most recently, our efforts over 20 plus years have come to fruition, and family peer support is valued and recognized and now included in the Medicaid state plan. So we're very excited and just to get started doing the work with Medicaid.
Yeah, thank you so much for the awesome work that you are doing around peer support. We are also very excited for that, and we appreciate you being here. Robin? Alexis? Tiffany?
Hi, everybody. Tiffany Olivas. I'm the Early Childhood Comprehensive Systems Manager 2 at the Children's Cabinet. I am the lead on a federal HRSA ECCS grant through the Maternal and Child Health Bureau. I think there are a lot of things that I'm really excited about, and I feel really good. We've been doing a lot of projects related to breaking down silos in early childhood. And one of our biggest accomplishments is the First Five Nevada website and the First Five Nevada Leadership Academy. And the reason I wanted to mention this as a success is because I'm noticing that we actually had a few graduates from the agencies and organizations that are represented here today. So I wanted to share that. The Leadership Academy wrapped up on March 31st. It's over 7-8 months of a pretty strict cohort of continuous learning. And we just finished up and we had amazing capstone projects delivered from each of our graduates. So I think that's the most thing I'm excited about, but there are others. So hopefully we get to do this more often. Thanks.
Yeah, thank you so much, Tiffany, and congrats to all of our graduates and to your successful program. That's so exciting, and welcome everybody who's here from that program. That's awesome. Gwyneth, I don't know if you had to step away or if you're back now, but if you're back, we'd love to hear from you.
I'm back. I apologize for the multitasking this afternoon. I'm Gwyneth Smith. I'm a Chief Deputy DA in Clark County in the Juvenile Division. I am proud of quite a few things that are going on in our state. I am proud of the persistence of the stakeholders and professionals and families in our state with initiatives like this, maintaining focus on the importance of youth mental health. And I see it from all across the state and a great diversity of professions and people all focused on one goal, which in the past we were siloed in ways, but I think we're not so siloed now. And I think that is fantastic. As someone who's in the court system every day, I am proud of programs that the court system is implementing specific to bringing resources for mental health services for youth and families. What the hearing I had to step away for just a few moments ago was the conclusion of a specialized court calendar here in Clark County called Meet Court, started by Judge Sunny Bailey, focused on services and oversight for children with FASD and autism spectrum disorder in the juvenile dependency system. It's a privilege as a DA to be part of that program, and it's really trying to target the underlying causes of the issues that we see arise in dependency cases. And so I am proud to be a part of that, and I look forward to the expansion of those kind of serviced focus calendars in our court system.
Yeah, that is so awesome and definitely needed. We're really grateful that you're here and sharing in your voice, and thank you for sharing about what you're proud of. And then Jonathan, who Jonathan actually told me he wasn't going to be able to join, but I did just want to be able to still say his name. So thank you so much, everybody. I feel like that was really lightening, knowing that a lot of what we're talking about is about some of the challenges that we're facing. So it was really awesome to be able to celebrate with all of you, and I'm very proud of you all. I really appreciate you being here, and I hope that you continue to find ways to celebrate the really awesome things that you're doing on a day-to-day basis. So moving forward, because we have so many new members in our working group, we wanted to briefly go over the purpose of our working group and how it fits into the DOJ settlement agreement. So if you joined our meeting last in February, this will feel really familiar. We took some of those slides again, but starting with the purpose, this group is meant to be a space where expertise, knowledge, and lived experience can be shared in response to some of the proposed policy and programmatic changes that Medicaid is working on for children's behavioral health. We all have a shared goal of serving kids and families in Nevada, and we want our systems to be working as smoothly and effectively as possible. So your role as a working group member really is to help us shape certain programs and operations, including the discussion that we're going to have later this evening, so that we can be achieving our transformation goals as they're written, and then also considering what we can be doing beyond the transformation plan itself. As we just saw, we have members of the working group who represent folks from across Nevada in a ton of different sectors, including youth with experience in Nevada's systems of care. We had parents, foster parents, caregivers, some awesome advocacy groups who are representing youth with experience, behavioral health providers, different levels of providers of different types of care, levels of care. We had a few provider organization representations, some tribal health providers and advocates, school health leaders and county partners and state agency, sister agency partners. And we're just so grateful for everyone's involvement. And we really value representation across the state in all types of interactions with Nevada's behavioral health programs for children. So thank you for being here. As a reminder, the format for working group meetings will now be every other month for 90 minutes. This is new for 2026. It used to be every month for 60 minutes. So the date is the same. It's the second Thursday of every month starting at 4 p.m. And then I'll have a reminder about our June meeting at the end of this meeting. So as a reminder for how the working group fits into the Department of Justice settlement agreement, this is all written into Section 7 of the agreement, which outlines the requirements for the state to have a system of stakeholder engagement throughout the process of implementing the transformation plan. So Nevada, we chose to create this working group as a way to consistently engage with stakeholders and ensure that we're bringing as many voices together to work toward the solutions that will benefit as many children and families as we can. If you're curious about the language, the Department of Justice settlement agreement is posted on our Children's Behavioral Health website, and then we can also add it into the chat. Okay. And then I am excited to be able to turn it over to the presentation over to Dr. Pebbles, who's going to be giving us an overview of the final selections for the screening tools. I want to give another huge thank you to everyone who attended the Screening Tool Summit on February 5th. To everyone who submitted a response to the initial and final screening tool surveys, and to those who met with Dr. Pebbles one-on-one to discuss which tools they are using every day and how they can be incorporated into the future selection. So together we shaped this list, and now I'm going to send it over to you, Dr. Pebbles.
Thank you so much, and thank you for joining us this evening. As I always say, I know there's places that you would probably rather be, but we appreciate you being here with us to improve care for the pediatric population in the state. So I just wanted to go over briefly for those who haven't gotten this exciting tidbit about what's going on. So the screening tools that we're trying to utilize, it's part of the Department of Justice settlement that outlines certain criteria that we have to meet. Mainly being that the screening tool must be brief. Brief is subjective sometimes in nature, but basically 10 minutes or less is how I interpret it to be. It needs to be mental health specific. It needs to be developmentally appropriate. And so that's something to the lines of, if the tool can be utilized for 16-year-olds, 3-year-olds, 5-year-olds, we need to make sure that it's applicable amongst a wider age range. And it must be validated, means it must be tested. It must be something that we proved has been effective and has shown us that there is outcomes that are consistent with what we're seeing. So the tool needs to be able to say, yes, this is what we're looking at, and it's consistent across the board, no matter who's screened. And so next, please. And so this is just a little bit about what's required in relation to that settlement and who is eligible for the screening. And so this is a question that I've been asked quite often. I just wanted to point out that box there on the right, and that's the verbiage that's used in the settlement. And basically it says that we're required, to choose a set. So not just 1 or 2 screening tools, but a set. And as you all know, and thank you again for meeting with me and discussing all of the amazing interventions that you're implementing in your environments, we get to choose a set because not everyone has the same environment. We're not all targeting the same illnesses or the same issues. And so that's why we get to choose a set of screening tools. So as you'll see here from this beautiful graphic that Carissa created, there's an overlap of a lot of the eligibility. So we have children that are eligible for Medicaid and those that are not eligible for Medicaid. And again, as a state and as an agency, we're trying to target all kids across the state. So you'll see on the left, the children eligible for Medicaid, that includes the periodic screening that usually occurs in pediatric offices, just to make sure there's no developmental delays or anything that we need to be aware of. The screening, if that screening indicates that there is a need for further assessment, and the child is eligible for Medicaid, they'll be referred for further assessment. So in other words, another level of assessment. The screening tools is pretty brief. Just basically, I always say that that first level is telling us who needs care, and the second level, where we collect a lot more information, tells us what kind of care they need. And so we'll get to that at a later date as far as that second level of care. On the right, you'll see that children not eligible for Medicaid, if the screening shows that there is a need, whether they call into a website, they go to a website, or call into a hotline. If they need some assessment, they'll be referred for that. And then in the center there is where you see the overlap, those receiving screening in particular environments, which we'll go over in the next slide. They'll have to request that screening, or the screening will be automatically started. So next slide, please. And then this is kind of where these screening assessments are mandatory, for lack of a better term for it. When a child is receiving healthcare services, especially if it's a well-child visit, and there's screening that's done that indicates that there's an additional need, that needs to be done. That screening needs to be done to make sure that we're being proactive. When they're engaged in certain entities, so county and state systems, so for instance, child welfare, if they enter an emergency shelter, if they're in the juvenile justice center, if they're on parole, including detention, things of that matter, they'll need to be screened just to make sure that especially that higher level of care that we're not missing anything. And so there are certain instances where that screening is mandatory. And then next slide, please. So this is what is the result of the culmination basically of the last year of we've been discussing these screening tools and trying to figure out how we best set this to make sure that it's applicable everywhere, no matter where this child is being screened. So you'll see on the left, these are the final screening tools that will be presented. They're being presented to an independent reviewer that has helped basically with this type of process in multiple states, and so they're aware of what's needed. It will also be reviewed by CMS, so the Center for Medicaid and Medicare, Department of Justice, and our state. They will then have the final say as to which are being approved for use within the state. Again, you'll see in that box on the right, we'll discuss that next level of assessment pretty soon here. So the general screening tools that were selected all the way on the left, there's some acronyms. If you use these often, you know exactly which ones we're talking about. If it is kind of confusing, please feel free to reach out to me, but I know there's a lot of letters and it seems pretty confusing. So to kind of give you an idea, the second one here on the left, ASQ, that's a screening questionnaire that goes over strengths. And then we have the BAC that's used for little kids, DSM that tells us if there's a concern in a wide variety of illnesses. And then you'll notice some of these other ones. There's one toward the end that's called a PSC. That's a pediatric screening checklist that was also approved. So there's a couple of different screening tools there on the left. And then the targeted ones, those are more of, okay, we know that there's an issue. Now we need to target what exactly is going on. And so that can vary. That can vary from ruling out ADHD with the Vanderbilt Assessment Scale. That can rule out any kind of issues with mania, so children presenting with bipolar disorder or symptoms associated with that. There's a lot of different things that can be occurring, and so we try to pick tools that apply to different settings and different illnesses that we wish to be our concentration. So these are the tools that are selected. You're welcome to ask me questions and shoot me an email if you want to. And so this is kind of our final recommendation, and we'll move on and you'll get some information in the near future about that next level and talking about that next level of screening tools.
I was muted still. Thank you so much, Dr. Pebbles. We really appreciate all the amazing work that you have been doing for the screening tools. That was really a great overview, and it's been a journey to get there. So thank you for your hard work.